to this MOOC on the sociology of health and illness. This is Module 7, State and Health, and today we are discussing the unit titled Health as a Fundamental Right. First of all, let us understand what health means. Now, the first definition or the official established definition of the concept of health was given by the World Health Organization, that is the WHO, in the 1940s. In its definition of health, the WHO stated that it encompasses three main dimensions: the physical, mental, and the social. And therefore, it stated that health means a state of complete physical, mental, and social well-being, and not merely the absence of disease or any infirmity. We all know that whenever we talk about health, it reminds us of diseases, that is, the physical state of one's being. Now, this definition established by the World Health Organization points out that the mere absence or presence of diseases in the physical state of being of a person does not or is not sufficient to define the idea of health. Additionally, it is very important to take into account the dimensions of the mental and the social. Of course, nowadays there is a lot of awareness about mental health, and when we talk about the idea of the social dimension of health, we refer to the social conditions of living of a human being, and that could be the family environment that one is part of, the access that a human being has to nutrition or food in the growing up stages. All of these together bring up the idea of, or the holistic idea of, a healthy human being. Now we know that it is only with the birth of the United Nations that the idea of health gained, number one, a definition, and number two, therefore, it became a concern of social development. And that was in the mid of the 20th century. Now, if we look at the historical perspective of how health became a concern for social development, in this regard, the 30th World Health Assembly, held in May 1977, is very important because it stated that the main social target of governments and WHO in the coming decades should be the attainment of all citizens of the world by the year 2000 of a level of health that will permit them to lead a socially and economically productive life. Now, with this definition and with this establishment, the idea of health for all by the year 2000 became a social goal for all governments. Remember, this was the later half of the 20th century, that was 1977, and the target therefore was set for 2000, the new millennia. Now, if we talk about the context of India and how health has been looked at and analyzed here, then we see that after independence, that is after 1947, the sector of health found a place in the 5-year plans of India. So, India then focused on a planned effort to raise the standard of living of the people, and impetus was given to healthcare, which was made an integral part of socio-economic development. Now, because health was a state subject under the Constitution, therefore, the state governments undertook various initiatives to improve healthcare in their respective states, of course, based on guidelines and targets and rules and regulations set out by the central government. But basically, health was a part of the 5-year plans. We will further discuss the idea of health and healthcare and policies or initiatives taken towards the health sector in India. But before that, it is essential to understand what is meant by the right to health vis-a-vis the idea of healthcare. Now, in this unit, we are discussing how health itself is a right for individuals, and therefore we must know how to differentiate between right to health and healthcare. To understand the idea of right to health, we refer to the definition given by the Committee on Economic, Social and Cultural Rights of the United Nations, CESCR, and it states that right to health means every person should enjoy the highest attainable standard of physical and mental health to lead a normal, healthy life. This means that an individual should have access to and should be able to enjoy all facilities that are available to him or her so that he or she can lead a normal, healthy life. And therefore, good health is a right for every individual. Now, this is different from the idea of healthcare. Now, what does healthcare mean? Healthcare means the facilities that are available to attend to any health-related issues. So, while the right to health means the entitlement of individuals towards facilities of healthcare, healthcare, on the other hand, refers to those particular facilities which are available to people to attend to any of their health-related issues. Therefore, examples of healthcare facilities would be hospitals, good equipments, good doctors. Now, what do you think when India embarked on a journey towards social development and it understood that health was an important indicator of social development? In that scenario, what could have India defined as its objectives of healthcare planning? Here we can see three very precise objectives that the government of India then established. One, to achieve an acceptable standard of good health of the Indian population. Two, decentralizing the public health system by upgrading infrastructure in existing institutions. Three, ensuring more equitable access to health services across the social and geographical expanse of India. Now, the first of all the objectives is a very general statement, very broad statement. Of course, if there were healthcare planning and policy making going on, then the primary motive behind it is to achieve an acceptable standard of good health of its population. But how do we achieve an acceptable standard of good health for the entire population while India remains to be a huge country, diverse in all aspects? Therefore, the rest of the two objectives are in place. Decentralize the public health system by upgrading infrastructure. So they are talking about technologically upgrading the existing infrastructure so that it can be more efficient and provide efficient healthcare services to the people. Also, decentralize the services and decentralize the public health system. That is the government designed, government initiated health system or the healthcare facilities that were available for people to use. That particular system and that particular mechanic should be decentralized. That is, the facility should not only be used by only a few at the top or only a few here and there, but the facility should be able to have a trickle-down effect. That is, the benefits of the existing public health system should be enjoyed by people at all levels across the whole of the country, irrespective of dimensions of caste, class, geographical location, which is mentioned in the next point, etc. Thereby making the healthcare system and the public health system in India accessible to the common public across the country. In order to attain the objectives set out, the government of India has over time formed different committees, and here is a list of different committees formed by the government to look into the scenario of health in India. So all of these committees analyzed the health scenario in India and then provided recommendations as to what should be done to improve the health scenario. And all of these committees over a span of 30 years or so, 30 to 40 years, and all of these committees over a span of 3 to 4 decades have provided different kind of recommendations depending on the state of health in those times. And the successive committees took follow-up actions, and based on those recommendations, the governments have initiated different plans, and that is how the trajectory of health in India has been carried on. In the trajectory of healthcare planning in India and the initiatives taken up by the government over a period of time, the national health policies and the national population policy have found a significant place. The first national health policy in India was introduced in 1983, that is towards the latter part, towards the end of the 20th century. And while, of course, the national health policy had a lot of objectives, critical targets, then there would be other goals that the policy had in mind. However, here we are only highlighting the critical targets of the policies. So the 1983 national policy focused on promoting universal and comprehensive primary health services for people in India. So when we say universal and comprehensive, we know that it should be equally accessible to the entire population of the country. And how can we make it accessible? Is by bringing it to the people across India, and by making the services easy to be used by people. The next important landmark here is the National Population Policy of 2000, and here the primary focuses were on family planning and child health. Now, the idea of family planning and particularly that is birth control has been in mind while looking at the health scenario of India since independence. However, the targets set by different policies, set by different 5-year plans, was yet to be achieved, and therefore we find that family planning is an issue of concern even today, and therefore in the population policy of 2000, again they talk about family planning. The next important landmark in this regard is the National Health Policy of 2002. Here, the emphasis was on declining sex ratio, total fertility rate, and the minimum needs program. We all know that sex ratio refers to the number of females per 1,000 males, and that many states in India do not paint a very healthy picture when it comes to the sex ratio, and therefore the 2002 National Health Policy emphasized that the Indian healthcare system should look towards improving the scenario of sex ratio in India. Likewise, they focused on bringing down the total fertility rate, and then they focused on making the minimum needs program more accessible and therefore more beneficial and target-oriented for the people of India. Now, the minimum needs program, to be specific, was introduced in the 5th 5-year plan, and it aimed to provide certain basic minimum needs to the people so that their living conditions could be improved. Another important landmark of recent times in the trajectory of healthcare planning in India is the National Health Mission. Now, we are all very familiar with the National Rural Health Missions in our respective states in different parts of India, and the National Health Mission can be two primary characteristics of the National Health Mission, if I have to say, are that it ensured a decentralized, accessible health delivery system to the people, and of course, there was a greater emphasis on the rural sector. Now we know that with the privatization of health services in India, access to health services means a hefty amount. That is, it is not for free. Health services in India are not always for free. Of course, the government sector provides free health services to its people through the government hospitals and other government policies and establishments. However, with the increasing privatization of health services, health has become or the maintenance of a good health has become a costly affair. In this scenario, the government's initiative of the National Health Mission is very effective, because it ensures that a robust healthcare system is given out to the people at a very low cost or no cost at all, which means that the healthcare system automatically becomes accessible to even the common people of the country who may not otherwise be able to afford a very expensive healthcare treatment. The focus of the National Health Mission on the rural sectors of or the rural areas of the country further means that people who are in remote locations, that is geographically far away or isolated, or that people who are economically in the lower rungs of the economic ladder or in the lower rungs of the social ladder, or who may even lack information about the healthcare systems that are available to them. It is for these kind of people that the National Health Mission particularly targets. And this approach of providing benefits and resources in terms of healthcare at the grassroots have brought about a holistic social development. Now, while it is easy to say that health is a right or that health is a fundamental right of every individual, this actually brings us to more difficult questions. Questions like, how can this right be exercised by people? What steps are being taken by the government or by the community, the society at large, or what steps are we taking so that we can exercise this right? What healthcare facilities are at our disposal? Are we as individuals aware of those healthcare facilities that are accessible, that are there for us to use? Have we used them? Can we use them? How do we know how to use them? Therefore, it is essential to understand not only the fact that good health is a right of every individual, but also the background to it, that is how to exercise this right. We will discuss this in the course of this lecture, but before that, we must understand what health means. In this unit, we have got an overview of what is meant by health. We have outlined a brief historical perspective of how health became a concern of social development at the global level and also in the context of India. We have seen in the context of India how health gained a place in the 5-year plans in independent India, and then how health became an individual pillar of or indicator of indicating social development, and how the trajectory of healthcare planning in India has grown over time. We have also highlighted the differences between the ideas of right to health vis-a-vis healthcare. And then we have discussed in quite detail the objectives of healthcare planning in India, and then the trajectory or the initiatives that different governments over so many decades, that different governments over decades have taken in order to improve the health scenario in India. And the objective has always been equitable and accessible healthcare system for the people of the country.